practice the machine. Good. I came back from the UK in 2000, end of 2010. Started to apply in 2011. Then in quarter 2018 they approved it.
We have done now is we have developed practice machine now in India,
Yeah.
and currently the application is on for type of law. So once it is done, and we send we transfer to a vendor, and we make next year. Maybe next year it will be one-fourth the cost.
One for the cost for the
And
applicator.
everything is complete. For training, we have done training right now. So including
Hi, everyone. So we have our lady here, Phantom,
EPS.
and
So it's a medium, not
we have the four different applicators here. You can watch from here, or you can join us. We have Venezia now.
that with the
Let me
just try
let me first introduce them. Then we can have a hands-on. Okay.
before you start printing.
So
Logistics.
can you zoom on these, please? Could you just help me with that? Um,
Yes, what they send you? Yes, yes.
may I have this? There. Impossible. Can I have it here? Like that? Doesn't matter. I'll speak up.
All shapes. You can't see because you are blocking the screen. So
The
you
screen
want-
will show it.
So you
They
need,
will see
you
you
need to set.
in the big screen after.
You can have a chair and sit on it.
Everything is here.
Yes,
I think you can see.
we are.
Yeah.
They want to sit in.
You want to sit?
No.
No, no.
I don't.
Somebody on this side can see. They can read the screen or because you stand in front of it. Just sit.
Okay. This is perfect. So, is it open? Perfect. So we have different kinds of applicators here. The Venezia is this one. It has a tandem which treats the cervical cancer. You can go inside the uterus with this tandem, and you can create the pear-shaped dose distribution with these lunar ovoids. So they are very easy to use. Even though it looks like a ring, these are two ovoids. So we have three channels, three catheters here. So this is for the cervical cancer, and you can increase the reach. You can increase the reach of the dose distribution by introducing. Sorry. May I? By introducing interstitial needles. So you have a, let me show this. You have a guide tube here, and you have a needle which is plastic. These are called pro-guide needles. You can have a sharp tip, you can have a round one, you can have different lengths. And I have an obturator just to help me to go inside, to puncture the skin, let's say. And I use the guiding tube. I don't go out. So I can fix it on the ovoid. I can have perpendicular insertion like that, or I can have 45 degrees insertion so that I can go away from the tendon, so I can reach more space like that. So there are different insertion points here on the, just a moment. Yeah. On the ovoids, there are different insertion points. If you place it here, it's perpendicular. If you place the guiding tube like that, it's 45 degrees. Okay? Just like that. Okay? So, this is the cervical part. You can also use vaginal caps like that, so that you can irradiate the vagina while you are irradiating the cervix. So these are for more advanced stages of cancer. So what you do is you use a cap. This is one and this is two. You just click the cap before insertion, of course. Same here. And inside the patient, you can do that. Of course, you need catheters here, so you use other guiding tubes to guide to which side of the vagina you want, and you can even use these to go like that. So you can irradiate vagina and cervix at the same time. Also, this is Venezia. Venezia, yeah. You also have perineal templates for advanced stage 4, for example, metastasis. And when you're inside, like that, let me show you. So let me go inside. That's very hard to do. Without going inside, I'll show you. During hands-on, you can see. There is this perineal template. This is not it. I think it's inside. Yeah, I found it. So you can fix just before the skin this template, and if you've seen the prostate templates, it's very similar. So you can use obturators again, and you can lock. And on the template there are letters and numbers, so you can reproduce this insertion for other fractionations. So it's like a Swiss knife of brachy. You can do everything with it: vagina, cervix, and perineal irradiation. If you are familiar with Fletcher tandem and ovoids, this is the newest applicator. This is Geneva. So in the nucleotron era, and actually in electro era also, the Fletcher was very hard to assemble. It had many screws, and it was very hard to sterilize because you lose all the screws, they fall off. So they got a better applicator now. Without screws, you can do the same thing as Fletcher, and even better. So everything is without screws. You can just decide on the size of the ovoid, and you just click it like this. Same thing here. You just click it like that. Tandems are the same. When you insert the tandem, you just need to follow the catheter and click. Follow the catheter and click. You just need to use a cap here to fix, and you can notice that it's moving inside patient. So we just use this fixation. It's a hand screw, so that no more movement. So this is a tandem and ovoid Geneva. It also has, it also has the same needles. You can use the needles like Venezia. You can use the same needles, same guides, everything like that. No change of angles here, but there's a catch. So if you have a removed uterus and you need to, so you cannot use a tandem. So it's an operated uterus. So what you should do if there's a residue, or how do you irradiate with brachy? So you use a tandem and ovoid without a tandem. In the old times, they tried to use Fletcher without tandem, but now there's a better solution, and it's this one, a tandem without a tandem. So you don't go inside uterus because there is no uterus, and you just fix. The good thing is, if there is a residue where the uterus was, then you can use a needle also. Okay. Can use a needle instead of a tandem, because you cannot enter the uterus, but you can use a needle to go forward.
What's the benefit of the needle?
This is for any residual tumor, but there's no uterus, so you have to use a needle just on that point.
Okay, but that one pierce, it won't pierce the stomach.
But there's no,
Okay.
it's removed.
Yes, yes, it opens the uterine cavity.
Okay. So the,
You can put more than one needle in here?
of course, you can have all the needles
in the middle.
necessary.
In the middle.
In the middle, only one.
Only one?
Yeah. But in these bigger ovoids, you have needles on top. Yeah. Also, we have applicators for. You are very familiar with the standard vaginal, of course. We have one multi-channel. Would you like to continue or answer any questions?
So question is, how many of you have these applicators? Venezia and Geneva. Anybody has?
No.
Which applicators do you all have?
Another second one.
Which applicators? You have the BBIC. Yeah. Okay. BBIC. Okay. So that's more or less same. So it's but more or less they are same. Principle is the same. So it is intracavitary plus interstitial.
Menopia doesn't have Venezia or Geneva, and Luxor doesn't have. They have Fletcher.
Luxor like us.
Yeah.
Lecture, train without needles and train with needles.
Yeah. So no Genoa and Venezia in Egypt.
Hopefully
Next time.
next month we'll
Yeah.
have Geneva.
I'm not sure, but since nobody has, so if you are using vaginal caps, okay, so you cannot use divergent needles. It will only be straight. It has to be only straight. So you cannot use divergent in the lateral parametrium. Having said that, how to use now? Because there are some situations where you need divergent needles as well. So what we do is, in first application, we do divergent.
Nice. Hybrid.
Okay, so then 2 fractions are given with divergent, but the total dose is for 4 fractions in those needles. Okay, so next application we put vaginal caps and we put straight, and then vaginal cap gets 4 fractions doses in 2 fractions. So that's how we combine both and make it 4 fraction equivalent doses. Okay, so that's. Because needle loading usually you put 10%. So if let's say divergent needle has 10%, so you make it 20% per fraction. So you give 2 fractions, so it is 40% already. And then next application you don't put divergent, and you put vaginal straight. So vagina, if it is 10% loading, make it 20 per fraction, so it becomes 40. So at the end of 4 fractions, it is 10% doses which has gone to the entire. So that's how you would do it. Okay. Yeah.
20 twice and 20 twice, which is 40.
Yeah. So it becomes 10% for every fraction. The other thing is for physicists, I don't know how many of you are there, but the tandem has an offset of 12 millimeters in the tandem, whereas in Geneva, I think it is now 8 offset.
The total offset is 8.
8 in Geneva.
Yeah.
But in Venezia, it is 12, still 12. Okay. Unless they have changed, yeah. It's
So
12.
there are 2 types of offsets. One is for the
Physical
first
tip.
developed position plus the tip.
Yeah.
So it's 8 actually.
Yeah. So this is part of your commissioning, you'll have to check that. And of course, he mentioned that you have 2 types of needles, sharp and blunt. We usually if we are treating cervical cancer patients, we usually do blunt. And if it is post-hysterectomy, then we use sharp needles, because in post-hysterectomy there is fibrosis. So you need some sharp tip to go into the tissue, into fibrous tissue. Whereas if it is per primum cervical cancer, then you don't need sharp tip, because it has to only pierce the mucosa, rest all is just goes in fatty tissue, so it will go in very easily. Same is true for tulip also. Yeah. So, but then always everybody says, oh, it is so scary, if there is bleeding, what will happen? Everybody thinks about bleeding first. Okay, but it never happens in principle with blunt tubes, because I always tell that blunt tube has this effect, elastic effect, and artery will never get punctured with this, because the artery has a lot of more pressure than what pressure you are putting. So it will always push away from the artery. The artery wall will push the tube away, the tip away from there. But vein, yes, it will pierce the vein. But venous. Yeah. So this sharp tip can cause injury to artery, small arteries. But having said that, I have not seen arterial bleed yet. So in my 12-15 years practice now. Okay. But otherwise, I think more or less these two applicators now are quite useful and handy in terms of locking systems. No screws, nothing. You just click and it locks. So that's an advantage of new applicators. The last important point is sterilization. Please follow the manual. Word of caution, autoclaving is a bit dangerous for these. Although vendors say that autoclave is also okay, but autoclave makes these yellow parts very brittle. And the most vital part is this. When you are connecting, no, it is daily connecting. So if this becomes brittle, no, this gets broken very easily. So I recommend everybody that either do plasma or ETO. That is more safer than autoclave, although they recommend all three. But then this is very brittle. This becomes very brittle with temperature. Yeah.
Okay.
And the last point is the rectal separator.
I think they didn't.
It's not there.
There's one for Geneva
So
only.
rectal separator is put here, but rectal separator should be only used when you are not doing interstitial component. If you are going to push interstitial component, then rectal separator is not useful, because it will come in the way of your tubes. Okay.
You can
And
use
plus,
packing.
yeah. Plus, if there is no enough space, especially when you put vaginal caps, when you push the rectal separator, this comes down because of limited capacity. If this comes down, then you will start losing the dosimetry effect of what? Yeah. So if you are using vaginal cap, no packing. Okay. But if you are not using vaginal cap and you want to use rectal separator, that's okay. But when you put this rectal separator, then the remaining part of vagina is packed, remaining part here, so that everything gets fixed to the os. The assembly is here, fixed. If you don't pack inferiorly, with the separator, it will come down, because you should remember that we are doing it under anesthesia or whatever. The vagina is stretched, and subconsciously women will push the applicator down because of pain in the perineum. So if it comes down, if there is no pack, then it will come down easily. If there is pack, then it will not come. Okay.
Okay.
Thank
Thank
you.
you. Thank you very much.
But you can practice on this dummy maybe tomorrow in your glass house.
If there's a
Yeah, but you cannot see
there's
inside.
Dr. Abdul Karim,
So
he's not here, but we will ask if we
yeah,
can use.
but for that you have to individually go and work there. It cannot be demonstrated. You have to do that, and somebody has to hold the uterus from here inside, so that it is stable, and then you can push. Yeah.
So let me.
This is demo's piece, right?
Yes.
Okay.
Not
Then,
for
then it is safe. So maybe quickly we finish the
contouring exercise? How many of you are in favor of, how much time do we have, Mika? So we have 1 hour to finish our contouring. So how many laptops? How many of you have laptops? 1,